Stand by.
Good morning, good afternoon, and good evening, everyone. Karibuni, as we say in Swahili. Welcome. My name is Zain Verjee. I'm from Kenya. I'm a former CNN journalist turned entrepreneur. I'm a storyteller, and I'm a runner. In fact, I am the fastest Kenyan in West LA. Welcome to the launch of A World in Disorder, the latest report by the Global Preparedness Monitoring Board. This event is being live streamed on the WHO social media channels. The board is an independent monitoring and accountability body to ensure preparedness for global health crises. It was convened by the World Bank and the World Health Organization and is made up of political leaders, agency principals, and world-class experts. The work of the board is to chart a roadmap for a safer world for all of us. This year's report highlights the following: how the world was just unprepared for a pandemic, and COVID-19 took advantage of this. That the world was warned about the devastating impact of a pandemic and had all the tools to deal with the threat, yet failed. And that now we are witnessing widespread economic and social destruction. Since the pandemic struck, I have invested all of my efforts and time in Africa, looking for ways to communicate key messages to both urban and rural communities. In partnership with MasterCard Foundation, we created COVIDHQAfrica.com to be Africa's own center for data and information. Africa has reported more than 1.3 million COVID infections and at least 30,000 deaths. Testing is a challenge, community transmission is rising, contact tracing efforts are tentative, and lockdowns are costing the continent more than $65 billion a month. Across Africa, like many other places, the cost of this pandemic will be felt for years to come. I'd now like to invite the co-chairs of the Global Preparedness Monitoring Board to share some of the details of this important report. Her Excellency, Dr. Gro Harlem Brundtland, former Prime Minister of Norway and former WHO Director General, and Mr. Elhaj Assi, co-chair of the Kofi Annan Foundation and former Secretary General of the International Federation of the Red Cross and Red Crescent Societies. Dr. Brundtland.
Thank you, Zain. We are glad to be here to share the findings of our report, A World in Disorder. Last year, we issued a stern warning of the dangers posed by a rapidly moving pandemic, of a respiratory pathogen that could kill millions and wipe out 5% of the world economy. We warned that the world was ill prepared for such a pandemic. Tragically and catastrophically, we have seen our worst fears realized. The impact of COVID-19 is even worse than we anticipated. But actions that we called for last year have still not been taken. Without such action, the world remains vulnerable. So will this happen again? Unfortunately, yes. Exactly when and where, we do not know, but everything humanity is currently doing to our planet makes another pandemic inevitable. The good news is that there are actions we can take to prevent a pandemic and to mitigate its impact. But will we take these actions with the commitment and investment they warrant? Past experience warns us of the perils of falling back into the cycle of panic and neglect. We urge leaders not to repeat the past, but to learn from it and use these lessons to build back better. As the board began to discuss our 2020 report, we came to several conclusions based on our collective experience of the COVID-19 pandemic. First, the cycle of panic and neglect has had catastrophic health, social, economic, and political consequences, especially for the vulnerable and disadvantaged. COVID-19 has demonstrated the importance of protecting lives and livelihoods and preventing outbreaks from becoming pandemics. Second, it starts and ends at the country level. Political leadership makes the difference. Responsible leaders act decisively on the basis of science, evidence, and best practice, and in the interest of their people. Responsible citizens demonstrate social and moral responsibility by acting in the best interest of all. For preparedness is not only what governments do to protect their people, it is also what people do to protect each other. Third, the return on investment in pandemic preparedness is immense. Estimates of the cost of prevention and preparedness are measured in billions of dollars. But the cost of a pandemic is measured in trillions. It will take 500 years to spend what we need to invest in preparedness, as the world is now losing to COVID-19. Now, later this week, we will address a joint meeting of G20 finance and health ministers. Back in 2008, the bold and coordinated interventions of G20 countries averted a global financial collapse and helped to speed the economic recovery that followed. We call on them to take similar coordinated action to protect the global economy from the devastation it is now facing. But we must also look at the future financing of preparedness. Global health security cannot continue to rely on development assistance. It is inadequate in scale, unpredictable in nature, and depends on the generosity of a small group of countries and donors. We call on the United Nations, WHO, and the international financial institutions to develop a mechanism to ensure sustainable, predictable financing on the scale that is required. One that recognizes pandemic preparedness as a common good and is based on the principle of commonality. As part of this, we call on the World Bank and other international financial institutions to make R&D investments eligible for financing and to develop mechanisms to provide financing for global R&D for health emergencies. And finally, no one is safe until all are safe. A pandemic is by definition a global event and demands collective global action. Any efforts to weaken and undermine the multilateral system will have serious consequences on global health security. We need a strong multilateral system, one that is empowered, not abandoned, and fully supported by all national leaders. If we are truly to say never again to a pandemic, we must act now to prepare for and prevent future pandemics. I will now hand over to my co-chair to describe further the actions we call for to mitigate the impact of the current pandemic and better prepare us all for the next one.
Thank you very much, Gro. Our report indeed does make 5 calls for action that leaders and citizens must take boldly, decisively, and urgently to bring order to our world. First and foremost, we need responsible leadership at local, national, and global levels. Leaders at all these levels of society must build trust with their people, take decisive action based on the best scientific evidence, discourage the politicization of measures, and to protect public health, ensure social protection, and promote national unity and global solidarity. Heads of governments must appoint a national high-level coordinator with authority and accountability to lead pandemic preparedness and response across the whole of government and the whole of society. And we call on national leaders, manufacturers, and international organizations to ensure that COVID-19 vaccines and treatments are allocated fairly and equitably in ways that will help to stop the pandemic, with healthcare workers and the most vulnerable having priority access. When effective vaccines begin to become available, every country should get an initial allocation of vaccines sufficient to cover at least 2% of its population to protect frontline healthcare workers. Second, we call for engaged citizenship. Pandemic begin and end in communities. Citizens play a crucial role in holding governments accountable, and they must be empowered to do so. Citizens need accurate and consistent public health messages from their leaders to reduce the harmful impact of misinformation. We are deeply concerned by the proliferation of fake news and the misleading anti-vaccination movement, which threaten to exacerbate and prolong the pandemic. And we call on people to act in the interest of others to seek the common good. Adopting health-protecting measures may be inconvenient, but these actions help to protect the most vulnerable. And if they protect the most vulnerable, they protect us all. Third, we need agile national and global systems for global health security to equip all spheres of life for a pandemic. We need whole of government and whole of society approaches that encompass all aspects of preparedness. These include systems that integrate animal and human health for tracking the emergence of pathogens with pandemic potential, systems for surveillance, early detection and sharing of information on outbreaks and similar events, health systems based on universal health coverage, with surge capacity for clinical and supportive services, and system of social protection to safeguard the vulnerable, indeed leaving no one behind. We welcome the work of the ACT Accelerator and the COVAX facility. These initiatives demonstrate the need for a long-term sustainable mechanism to ensure rapid development and equitable access to vaccines, therapeutics, diagnostics, and non-pharmaceutical interventions for health emergencies. And we call for a robust multilateral system to support pandemic preparedness and response. The World Health Organization should be strengthened, not weakened. It should be strengthened as an impartial and independent international organization responsible for directing and coordinating pandemic preparedness and response. Fourth, we call for sustained investment in preparedness. Financing is key to end this pandemic and to protect us from the next one. Immediate action is needed to mitigate the economic and socioeconomic consequences of COVID-19. As you said, Gro, The action of the G20 countries in 2008 averted a global financial collapse at that time. The world needs them to do the same now. Financing preparedness for the future demands our attention and action. Countries have the primary responsibilities to finance preparedness from their domestic resources, but external funding is also needed to help poorer countries and countries in fragile settings. In addition, global financing is needed for global preparedness mechanisms and for the development, production, and distribution of common goods. International funding for preparedness cannot continue to rely only on development assistance. We need international mechanisms that can meet these needs predictably, sustainability, and of the magnitude that we all require. Fifth, we call for a strengthened global governance of preparedness for health emergencies. The first step will be to revise and strengthen the international health regulations. In addition, we need predictive and comprehensive mechanisms for assessing the pandemic preparedness across all sectors. Finally, and perhaps most importantly, we call on the UN Secretary General, the World Health Organization Director General, and the heads of the international financing institutions to work with national governments in convening a summit on global health security. The purpose of this summit would be to reach agreement on an international framework for pandemic preparedness and response, incorporating the revised international health regulations and including mechanisms for sustainable financing, research and development, social protection, equitable access to countermeasures for all, and mutual accountability. COVID-19 has brought us to a crossroad. One path continues down the road of panic and neglect, unfortunately, leading to catastrophe and devastation. The other creates an opportunity to recognize the vulnerability in our interconnected, crowded, environmentally stressed planet and embraces our common humanity in formulating effective solutions. Yes, we have only one planet and we must protect it. We have only one humanity and we must care for it. GPMB presents this report to encourage that in partnership and in solidarity. Thank you.
Thank you very much, Dr. Brundtland and Mr. C, for your words. The phrase cycle of panic and neglect is such an apt term for how we approach pandemics. And we're so appreciative that the board has taken the time here and outlined what needs to be done to end that cycle. Many years ago, while I was at CNN, I met a health minister who became the foreign minister of Ethiopia. I recall our conversations in Addis Ababa and in New York City fondly. He is brilliant, compassionate, and elegant always. It's my pleasure and honor to welcome my friend, Dr. Tedros Ghebreyesus, the Director General of the World Health Organization and one of the co-conveners of the board, to share his perspective on this report. Dr. Tedros.
Thank you so much, Zain. That's very kind of you. Thank you for the introduction, my friend. Your Excellency, Dr. Gro Harlem Brundtland, and Your Excellency, Ms. Asi, Excellencies, dear colleagues and friends. 2 years ago, the World Bank and the World Health Organization founded the Global Preparedness Monitoring Board out of concern that the world was stuck, as both Dr. Brundtland and Dr. Asi said, in a cycle of panic and neglect. In recent years, we have seen a recurring pattern. The world throws money at an outbreak, then does little to prevent the next one. We have had numerous reviews, reports, and recommendations Some have been heeded, many have not. It's as if we wait for the plane to crash, then call for more safety inspections. We wait until the town burns down, then decide we need a fire department. We wait until the storm comes, then try to fix the roof. Let me say it as clearly as I can. We have to work together, plan for the long term, and realize that spending on health and preparedness is not charity. It's an investment in our future. Governments and international agencies must be accountable to the populations we have pledged to serve. In this new report, the GPMB lays out the lessons the world must learn and the concrete actions we can take to protect ourselves. If we do not learn these lessons now and take the necessary steps to make our world safer, when will we? The COVID-19 pandemic has taken a huge toll on lives and livelihoods, disrupting health systems, economies, and societies. Even countries with advanced health systems and powerful economies have been overwhelmed. But many of the countries that have done well are those that have learned from previous outbreaks like SARS, MERS, H1N1, Ebola, and others. That muscle memory has prepared them for this pandemic. Now the whole world must develop the same muscle memory. We can no longer wring our hands and say something must be done. It's time for countries to get their hands dirty and build the public health systems to ensure a pandemic of this magnitude and severity never happens again. This will not be the last pandemic, nor the last global health emergency. But with the right political and financial investments now, we can prevent and mitigate future pandemics and protect our future and the future of generations to come. Every day that we stand by and do nothing is a day that brings us closer to the next global health emergency, whether from a disease outbreak, climate change, or a natural or self-inflicted disaster. We do not know what the next health emergency will be, but we know it will come, and we must be prepared. This is not fear-mongering. It is a call to action. We have the tools and the know-how to confront these challenges. It's the same reason we mandate seat belts, invest in fire departments, and vaccinate our children. The fact is, when it comes to preparedness, our biggest obstacle is ourselves. Short-term self-interest is simply not sufficient. It is a basic principle of public health. No individual alone can protect themselves from an outbreak, and no nation can act alone in a pandemic. We can only confront these global threats as a global community, united in solidarity and committed to long-term cooperation. 2020 has been a wake-up call. The COVID-19 pandemic has levied a terrible cost on humanity. These have been hard-won lessons. We must learn from them, and we must build back better. The GPMB has given us a plan. Thanks, ASI, thanks, GRO, thanks to all board members. If we, as national and international leaders, do not follow through, then we will have failed in our most fundamental responsibility to the populations we have pledged to serve. On behalf of WHO and our co-conveners, the World Bank, I would like to thank the co-chairs and board members for this report and for their recommendations once more. The responsibility now lies with all of us to act on them. I thank you. Thank you again, Zain. Thank you.
Thank you very much, Dr. Tedros, for offering those important words for all of us today. It's so great to see you, and thank you so much for your great leadership today. I'd now like to invite Ms. Henrietta Fore, the Executive Director of UNICEF and a member of the Global Preparedness Monitoring Board, to share her perspective on the urgent actions that need to be taken to protect everyone, especially the most vulnerable from pandemics. Ms. Fore.
Thank you very much, Zain, and thank you, Drs. Brundtland, Asi, and Tedros. On behalf of everyone at UNICEF, we welcome this report's launch. And we recognize the critical importance of the GPMB and organizations like WHO in shaping not only this report, but the future of preparedness and international public health architecture. When we presented the first report last September, we highlighted the risks of not being prepared for the pandemic. This year's report is not about risks. It's about the consequences of failing to heed this warning. As the data in the report clearly shows, COVID-19 is a global crisis made worse by a lack of preparedness at the global, national, and even at the community level. This lack of preparedness forced many countries to use the bluntest weapons in response, including lockdowns and travel disruptions that have affected nearly every aspect of people's lives. The hardest hit are the poorest and the most vulnerable, and in particular, the most vulnerable of all, children. This is a children's crisis. Over 1 billion children are losing out on an education. Health systems are stretched and mothers are going without basic services. Based on some projections, we could see a time in the next 6 months when up to 6,000 children die per day from a preventable cause. Life-saving vaccination campaigns have largely ground to a halt, including for measles, diphtheria, tetanus, and polio, putting a generation of children at risk of preventable diseases. Food and nutrition systems are strained, which could result in an additional 6.7 million children under 5 years of age suffering from wasting and an additional 10,000 deaths per month. We're seeing rises in violence, child labor, and even child marriage as lockdown measures and budgetary constraints keep children from the protections and services like counseling that they need. Communities without reliable or clean water systems are at a huge disadvantage in reducing the spread of the virus. 2 out of 5 people in sub-Saharan Africa have no access to hand washing facilities at all. And we're seeing economic hardships that could push another 100 million children into poverty. As a humanitarian organization, UNICEF is working around the clock to rapidly support the global response. And thanks to our donors and partners across the humanitarian system, we're delivering life-saving supplies, working with communities to provide information and messaging to prevent infection, providing online and distance learning to millions of out-of-school children, keeping vaccination campaigns up and running, and providing water, sanitation, and hygiene supplies to communities that are battling COVID-19. But as a development organization, we recognize that better and more coordinated preparedness could have helped us control the virus more quickly and with fewer deaths. As the report makes clear, we need sustained investment, not only to deal with the pandemic before us, but to prepare for future threats. This includes creating a dedicated mechanism to allow rapid deployment of funds at the beginning of a pandemic. UNICEF calls on the public and private sectors to join forces to develop new financing mechanisms to rapidly invest in the system protection and emergency preparedness over the short and the long run. We also require a stronger global architecture for health security to develop specific strategies for managing transportation disruptions, school closures, food shortages, and stretched health systems. This global coordination is not only essential to the equitable distribution of a vaccine, which UNICEF is supporting as the lead agency in the COVAX facility, but it is also necessary as an ingredient to help communities handle the devastating knock-on effects of other health emergencies in the future. And finally, we need to view all health emergencies through a single global lens. COVID-19 reminds us that what affects one country affects all countries. And so UNICEF joins the board's call for a new international framework for health emergency preparedness, one that will help all countries respond to health emergencies while building back better, stronger, and more prepared health systems for the future. We are in this together. We must respond together. We must rebuild together, and we must prepare together, because this is not the last emergency we will face. It will happen again. With all our global health partners today, we plan to emerge from the pandemic stronger and more united than before, and design the systems needed to better manage these emergencies in the future. Thank you very much, Hussein.
Thank you so much, Henrietta, for sharing your thoughts with us, and also for the great work that you're tirelessly doing for all of us. It's great to see you too. It's really clear from the A World in Disorder report that responsible political leadership and engaged citizenship makes a difference in pandemic preparedness and response. And so does effective communication. Here's a video produced by the Ministry of Health in Vietnam that has really made an impact in protecting communities against COVID-19. Please watch.
Of course we have to stay on guard, fight against this virus. Together you and I, we should stop it before getting worse. Wash your hands, slide out. Stick your hands, don't touch eyes, no smile. Let it go into all the crowds. Put an end to go around. Take care of your health. Keep your place clean and show yourself. Spread the thirst to everyone else. Put an end to go around.
That video is a really great example of how governments can promote public health action based on science while engaging communities effectively. So what does it really mean to end the cycle of panic and neglect around preparedness? We've heard that a few times today, so let's discuss it now, okay? Joining us are two members of the Global Preparedness Monitoring Board, Sir Jeremy Farrar, Director of Wellcome Trust, and Ilona Kickbush, Chair of the International Advisory Board of the Global Health Center. We also have Ms. Mamta Murthy, Vice President of Human Development at the World Bank, which is one of the co-conveners of the board, and Mr. Jagan Chapagain, Secretary General of the International Federation of the Red Cross and Red Crescent Societies. Thank you so much to all of you for being here today. Ilona, let me start with you. The first two calls to action in A World in Disorder are responsible leadership and engaged citizenship. From your perspective, what do these recommendations look like to you practically? And why are they so important in health emergencies?
Thank you very much, Zain. You will understand that I have a strong feeling of déjà vu. I was part of a number of committees after the Ebola outbreak and 5 years ago, and many of the things that are being recommended now were recommended then, and particularly as far as citizens and their involvement goes, you will remember how strong the recommendations were that the communities that were affected by Ebola would also be involved in fighting the disease and in building trust within the community. Interestingly enough, I think with the pandemic of COVID-19 hitting the developed world first, we did not think that we had to learn the lessons from the developing countries. And I think this is one of the features of this pandemic, that the developed world thought, this is not for us. Pandemics so far have been elsewhere, not in our part of the world. And I think one of the reasons we have this extraordinary spread and these difficulties that we're facing is because of exactly that. And the Director General already alluded to the fact that those countries in Asia, in Africa, that had the experience of involving citizens on the one hand and improving their governance on the other hand, are those that actually were able to deal with the pandemic better than some of the countries we have usually called developed. I think the second point that is really, really important and must not be underestimated, we speak a lot about the global governance we need, and that governance, of course, is based on a common outlook, on a common mindset, on an idea of common solidarity. And we've had the bad luck, I must say, that most tragically this pandemic has fallen into a geopolitical divide. And I think the world needs to learn again that no matter what the geopolitical tensions, we must work together on health. And that will be absolutely critical for one of the things we will need to do, and that is revise the international health regulations. And unless countries are willing to concede some of their sovereignty, to strengthen the World Health Organization, and to really, really, really invest in their own preparedness systems and help poor countries to invest in theirs, we are not going to be able to move away from this. So I think those are two key points that I'd like to leave for the panel to further discuss. Thank you.
Mr. Chapagain, as leader of the world's largest humanitarian organization, let's focus a little bit on community engagement and how it plays a role in pandemic preparedness. What's your view?
Thank you, Jan. Let me build on some of the things already being said. As my predecessor, Elhaj Assis, said, the epidemics and pandemics, they start and end in communities. And I think one of the really important element of responding to the pandemic is building trust in the communities. I think the many promises made in the past haven't been realized, from Alma-Ata to many other promises that have been made. And when the promises made don't get realized, the trust of the local communities and the international system weakens. So really building on that trust is extremely, extremely important. And when there is no trust, there is no acceptance. And as we saw that during Ebola crisis, the international coming into DRC with the solutions, ready-made solutions, it was very difficult in the beginning, that acceptance from the communities. And we had to invest on listening and understanding what the communities were saying, what their practices were, the cultural beliefs, the traditions. It was extremely important to listen to that. And once we started incorporating those advice and suggestions in our response, the trust started slowly building up. And I think some of the success we have now in DRC Ebola is because of that investment on the community engagement and accountability. So our response cannot be static. It has to be adaptive, and it has to be adapted by listening to the communities. And maybe just one small point I want to make is I absolutely agree that we have to invest on WHO and global institutions. But more importantly, I think the next phase will be investing on the local communities. I think if we don't change the pattern of investment from the globals to local, we will not be very successful in the future if we face with the pandemic again.
So Jeremy, within the theme of responsible leadership that we've heard, the report specifically calls out the importance of a fair and equitable vaccine allocation mechanism. Just explain to us why this was prioritized and how this is going to happen.
Yeah, thanks, Zain, and tribute to the co-chairs of the GPMB and WHO and World Bank for setting this GPMB group up, which has been truly independent. And I think the report is harsh and blunt, but actually realistic, I think. And I hope people will read it and take in. Vaccines are just part of the solution here. I mean, we've heard the importance of community and trust. We've heard them, and they are absolutely critical. We learned that in Ebola, we learned it in SARS many years ago. And vaccines are one part of this, investment in health systems, diagnostics, treatment, oxygen supplies, public health, PPE. And this really applies to all of them, to your question, Zain, and that is, none of us are safe until we're all safe. whether it be provision of protective equipment for healthcare workers or vaccines or indeed treatments. This has been the centerpiece of the ACT Accelerator, which the WHO pulled together and which has many, many partners from around the world, and specifically on vaccines, the COVAX facility, which increasing number of countries are now coming into because they realize actually it's in their enlightened self-interest. It is about global public goods. It is about equity. It is about access to all people, including the most vulnerable. But it's also in their enlightened self-interest because they will get the vaccines, the treatments quicker, they will get greater access to them, and they'll be better distributed around the world. So we have to get this right between equitable access and enlightened self-interest. And there is a sweet spot there, I think, on vaccines where that's very true. We don't need to vaccinate everybody in every population. We would be much wiser to vaccinate some people in all countries to protect all of us than all people in some countries. And this does need enlightened political leadership. This will change the world. And this is the sort of thing that leaders will be remembered for 100 years from now. Who stepped up and who made the difference?
And real quick, Sir Jeremy, as I recall Mr. C saying, it was every country should get 2% of its population vaccinated. Why 2%? Why is that a magic number?
There's nothing magic, but we estimate there are approximately 60 to 70 million healthcare workers around the world. They have to be the priority because we need healthcare workers. I'm a healthcare worker. We need healthcare workers for COVID, but we also need healthcare workers for all of the things Henrietta talked about earlier, vaccinating, maternal child health, mental health around the world. So we need healthcare workers now, and we need healthcare workers tomorrow when we come through COVID, and we must protect them. They're at great risk and they're very vulnerable.
Okay, thanks. Ms. Murthy, the report also references an estimate by the World Bank that the pandemic is costing the world something like $11 trillion, and we're still counting. So that number is just, mind-blowing. How do you think financing for global health security should be reformed? What are the practical steps to make that actually happen?
Thank you, Zain. Like the other panelists, I want to thank the global GPMB for a very important and timely report. Global health security financing must build on a bedrock of strong national financing. And this is where I think the first step has to be taken. We know that countries spend way too little out of the public purse on core public health functions and basic healthcare. Last year, we came out with a report which showed that amongst developing countries, let me talk about that group, which is the group that we focus on as the World Bank. The average expenditure on core public health and primary healthcare is about 10% of the public budget. And there's a huge variation. In some countries, it's as low as 3%, and in other countries, it's higher. And we would say that this needs to be adequately resourced. We estimate that by 2030, the shortfall in the financing in developing countries for primary healthcare and basic health services can be as high as $100 billion. So without more domestic resource mobilization for core public health, global health security is not going to go anywhere. Now, the second point I would make is we're in the middle of a big economic contraction. You talked about the huge economic losses. Well, what can one do during a huge economic contraction? Well, one can try to prioritize core public health services and reallocate towards core public health services. And we'd like to see governments doing that. Let's take the case of the debt service relief that developing countries are being provided. Well, they could move some of that money into core public health services. Other countries are raising taxes, for example, on tobacco, and that could go towards core public health. The third thing I would say is that international financial institutions like our own could also prioritize this. And we've tried to do so since the start of the pandemic. We've provided over $7 billion for this kind of thing, both fighting the pandemic and other core public health. So these would be my three practical measures to improve financing for global health security.
Thank you. You know, the consequences of COVID-19, as we've been hearing throughout the report and in all these conversations, are extending beyond the health sectors, which means health emergency preparedness can't be siloed, right, in the approach that we need to take going forward. And the report warns that we need to ensure that all sectors, health, economic, education, and social, are pandemic proof. So I just want to dig into the pandemic proofing piece of this report and start with Mr. Chapagain on this. What are your thoughts on pandemic proofing the social sector?
Thank you, Jen. Maybe I just want to build on a little bit what Jeremy said before. You know, when we talk about the 2%, and I absolutely agree that the healthcare professionals, doctors and nurses, absolutely. Right. But the one other sectors which we cannot forget is the volunteers. You know, as a Red Cross Red Crescent, of course, we had 14 million volunteers who got mobilized during this crisis. And there is 250 million people with the risk communications, and they have been working on the front line. And, you know, a number of volunteers have caught COVID and unfortunately have paid the ultimate price of their life. So these are, of course, these are Red Cross volunteers, but I know volunteers from many other organizations have also been absolutely on the front line. So I just wanted to highlight their contributions, and important not to forget that, while of course we prioritize the doctors and nurses. Coming back on the pandemic grouping, absolutely, it has to be multi-sectoral. It cannot be looked from one angle. And maybe just a couple of things I can share from my organization's perspective would be, one is really investing on the community resilience. I think building on the community resilience. And maybe the one thing I want to highlight here is, with all due respect, I think building back better is not good enough. We cannot go back to what brought us here. So we really have to build forward future. I think the way we built in the past has created hundreds of millions of people who are living in absolute situations in Africa and South Asia, where there's no basic health infrastructure, even after, I don't know how many decades of, after Alma-Ata. So we really have to build very differently. The future, the pandemic proofing we are thinking of, have to be much more inclusive in the future. So that means resilience building, absolutely empowered communities, engaged communities, and ability to act boldly, fast, and locally is very, very important. And the linked element, the second element, would be real investment on the social protection mechanisms. I think, of course, in Europe, with a very strong social protection mechanism, it was not enough. Imagine the situation in many other countries where the social protection mechanisms are very, very weak. So I think these two elements would be extremely important for the pandemic proofing.
Thank you. So Jeremy, from pandemic proofing's point of view, what are the key things or thing you would say from the health or economic perspective?
I think the fact that you just can't disconnect these. You know, here we have, it's these four circles. We have the health consequence, the indirect health consequence, as Henrietta said, about vaccines and cancer therapy and around the world. Then we have the economic, the trade, the educational opportunities, and finally the geopolitics, these overlapping circles, all of which gets thrown up in the air and disrupted when we have these sorts of crises. The GPMB report talks about the preparation and the response to that, but as in the 20th century, we're facing another time when we have to ask ourselves, do we want to come together as a world? Because if we look at the challenges we're going to face in the 21st century, they're all multilateral, they'll all be inequitable. We need the countries of the world to come together rather than splitting apart. And I think that is the gravest risk we face at the moment. We go to a polarized, more nationalistic world when the challenges we face are all multipolar.
Ms. Murthy, from your point of view, from international financing institutions thinking about pandemic proofing, what would you say?
Thank you, Zaid. I would say two things. Safety nets for people that can scale up as needed. That's the first thing. And the second thing is contingency plans for governments, for businesses, and for educational institutions, so that there can still be some sort of functioning that can happen even as things have to shut down. This is why we have really focused on supporting countries build safety nets, and currently we are providing resources so that over 1 billion people can receive money in their pockets from governments so that their livelihoods can go on. We're also supporting educational institutions in over 65 countries so that there can be some form of remote learning. It might be via TV, it might be via radio, it could be printed materials in many parts of the world. And of course, where people have access to the internet, it would be through the internet. So that would be our approach, safety nets, and then plans so that governments, businesses, and educational institutions can continue to function even during a pandemic.
Thank you. Ilona, the report also argues that the current governance for preparedness is just too complex. It's too fragmented. So how is this sort of prolonging the pandemic? What really needs to change? If you could sort of briefly offer a key thought on what we need to do differently.
Well, Zain, we have in the report a picture of the present governance, and I think anyone looking at that picture will sort of scratch their head and say, how come they get to do anything at all? But I think that's why we've called for this framework. That's why we've called for this Global Health Security Summit, because we do need to find a new structure. We need to find a new international agreement. And we, in a sense, need to put new order into this because, again, you know, even as you look at that complicated picture, there are still bits and pieces missing. Just think of the whole issues that are related, for example, to world trade, to a rethinking of the contribution of the World Trade Organization, our agreements on intellectual property, our agreements on global supply chains, etc. There is an enormous amount that we have learned that actually belongs to preparedness, to being pandemic proof within countries and internationally. So we do need to move ahead because many of these other issues we've mentioned won't fall into place unless we have that agreement in those other sectors. And I would just like to reiterate, it's about building forward. And if we're building forward, then we also have to include the new industries, the tech industries, the information industries. Otherwise, we will not be able to move.
Thank you very much, Ilona Kickbush, Sir Jeremy Farrar, Ms. Mamta Murthy, and Mr. Jagan Chapagain. Thank you so much to all our panelists for your insights, for your time, and some really important and engaging comments. Thank you very much. Finally, I would like to invite Dr. Brundtland and Mr. C back into this conversation and ask you both the same question. What is the one thing you would wish for the world to immediately do to mitigate the impact of the current pandemic and be better prepared for the next one? Dr. Brundtland, I'll start with you. If you have a magic wand, what would it be?
Well, what I want to do is to call on all leaders urgently to take their full responsibility. And that means protecting their own people while pursuing the only possible path available, which is global cooperation to overcome and to prevent threats that affect us all, because no one is safe until all are safe.
Thank you. Mr. C, your magic wand and wish.
Well, the report talks a lot about COVID, but frankly, it's more than COVID. It is what COVID reveals. And I think one big thing that we really need is a big move, a big movement, a global movement, you know, from what we politely call nationalism and I call egoism, then move from that egoism to solidarity and, you know, to more sharing of knowledge, sharing of financial resources, sharing of power, a move from isolation to more inclusion and partnership between rich and poor, between what we call usually the North and the South, partnership between men and women, and as COVID reminds us, a partnership between young and old, this generation and the next one. And finally, a big move from stigma, discrimination, scapegoating to more compassion, more care, and more support, because as Gro said, none of us is safe until we really all are.
Thank you so much. Mr. C, Dr. Brundtland, thank you. And we're so appreciative of the kind of work that you're doing here and navigating us through not only this pandemic, but in going forward, and what are some of the really important and key things we need to continue to think about and keep front and center. Thank you to all our participants for joining us today. I'd also like to thank you, the audience, for listening in. And I really want to share my appreciation once again for the Global Preparedness Monitoring Board putting out A World in Disorder. I hope that all of us leave this discussion inspired to use our power as citizens to hold our leaders accountable and to do our part for protecting the most vulnerable amongst us. As the report itself says, and I quote, "Preparedness is not only what governments do to protect their people, it is also what people do to protect each other." Thank you so much, everyone. Goodbye, take care, stay healthy, and love those near and dear to you. Thank you.